What is schizotypal personality disorder, SPD? Schizotypal personality disorder, SPD, is a personality disorder characterized by a range of cognitive and behavioral features that create significant social and occupational impairments. Individuals with SPD often experience odd or eccentric behavior, as well as delusions, beliefs, and perceptual experiences that do not conform to reality. These experiences can interfere with an individual's ability to form and maintain relationships, as well as their capacity to function effectively in society. SPD is part of the cluster A personality disorders, which are characterized by odd or eccentric behavior. Other cluster A disorders include paranoid personality disorder and schizoid personality disorder. However, while individuals with paranoid personality disorder often have a persistent distrust and suspicion of others, and those with schizoid personality disorder tend to avoid social interactions, individuals with SPD may have unusual beliefs, behaviors, or perceptual experiences that distinguish them from those with other cluster A disorders. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, describes SPD as a pervasive pattern of social and interpersonal deficits, as well as eccentricities in behavior, thought, and appearance. These deficits and eccentricities often manifest in early adulthood and are present across a variety of social and occupational contexts. The DSM-5 specifies that in order for a diagnosis of SPD to be made, an individual must have at least 5 of the following symptoms. Ideas of reference, believing that everyday events or situations have a special meaning, specifically related to oneself. Odd beliefs or magical thinking, believing in superstitions, paranormal phenomena, or having unusual or idiosyncratic beliefs. Unusual perceptual experiences, including bodily illusions or other illusions of external stimuli. Odd thinking or speech, vague, metaphorical, or stereotyped speech, odd or unusual use of language. Suspiciousness or paranoid ideation. Inappropriate or constricted affect, emotional expression that is flat or inappropriate. Behavior or appearance that is odd, eccentric, or peculiar. Lack of close friends or confidants other than first-degree relatives. Social anxiety that does not diminish with familiarity and tends to be associated with paranoid fears. Individuals with SPD may also experience other symptoms that are not listed in the DSM-5 criteria, such as anxiety, depression, and a heightened risk for developing other psychiatric disorders such as major depressive disorder or substance use disorder. Additionally, individuals with SPD may struggle with difficulties in self-care, including maintaining personal hygiene or nutrition, and may have difficulty functioning in daily life due to their odd or eccentric behaviors. The causes of SPD are not entirely understood, but researchers suggest that both genetic and environmental factors may contribute to its development. There is evidence to suggest that individuals with SPD may have structural and functional abnormalities in the brain, particularly in regions associated with social cognition and emotion regulation. Additionally, individuals who have experienced childhood trauma or who have a family history of schizophrenia or other psychotic disorders may be at an increased risk for developing SPD. There is no cure for SPD, but treatment can help individuals manage their symptoms and improve their quality of life. Treatment typically involves a combination of medication and psychotherapy. Antipsychotic medications may be used to reduce the severity of delusions or hallucinations, while mood stabilizers or antidepressants may be used to address co-occurring mood or anxiety disorders. Psychotherapy, particularly cognitive behavioral therapy, CBT, can help individuals with SPD to identify and challenge their maladaptive thoughts and behaviors, and to develop more adaptive coping skills. It is important to note that individuals with SPD may not always seek treatment, as they may not recognize that their behaviors or beliefs are unusual or problematic. Additionally, stigma surrounding mental illness may prevent individuals with SPD from seeking help or disclosing their symptoms to others. Therefore, early identification and intervention are critical for individuals with SPD to receive the appropriate treatment and support. It is also important for individuals with SPD to receive support from their families, friends, and communities. Social support can help to reduce feelings of isolation and stigma, and can provide individuals with the resources and encouragement they need to manage their symptoms effectively. Community support groups, such as those offered by the National Alliance on Mental Illness, NAMI, can provide individuals with SPD and their loved ones with education, advocacy, and peer support. Living with SPD can be challenging, but with appropriate treatment and support, individuals with this disorder can learn to manage their symptoms and improve their quality of life. It is important to recognize that individuals with SPD are not dangerous or violent, and that they deserve compassion, respect, and understanding. By increasing awareness and understanding of SPD, we can help to reduce the stigma and discrimination that individuals with this disorder often face, and promote a more inclusive and accepting society.